Hi everyone, how are you? Welcome to another question and answer session for MRCS exam. This is the question. You are working as an anatomy demonstrator and the medical students decide to test your knowledge on the circle of Willis. Which of the following comments is false? So it is one of the direct question that in case of circle of Willis, which statement is false? So first of all, read the option. The anterior communicating artery links the right and left side. Asymmetry of the circle of Willis is a risk factor for development of intracranial aneurysm. Majority of the blood flow passing through the vessels mixed together includes the anterior communicating artery, and the circle surrounds the stalk of the pituitary gland. So first of all, let's see the circle of Willis. Here we can see this is the circle of Willis. Here this is the circle of Willis, and it is formed by, this is the anterior cerebral artery, this is the anterior cerebral artery, here this is the posterior cerebral artery, here we can see it is the posterior cerebral artery, then we can see this is the posterior communicating artery, here this is the anterior communicating artery, and bifurcation of the basilar artery. So circle of Willis, it is formed by anterior communicating artery, posterior communicating artery, anterior cerebral artery, posterior cerebral artery, and bifurcation of the basilar artery. So this circle is known as the circle of Willis. In the second picture we can see this is the circle of Willis, and the pituitary gland, here we can see this is a very small pituitary gland, and this pituitary gland is located within the circle of Willis. In this picture we can see the blood flow such as from the basilar artery. The blood comes and it divides on the right side and the left side, and this goes together. On the other hand, from the internal carotid artery we can see it goes in the anterior part. So the blood within the blood vessels, when they circulate within the brain, they goes their pathway, they usually don't mix each other. So here there is no mixing of the blood. Then thirdly, here the same direction, here we can see the blood, it comes from the basilar artery or from the internal carotid artery, and they goes such as from the basilar artery it supplies the posterior segment of the brain. On the other hand, the internal carotid artery, it gives branches and it supplies the anterior segment of the brain. So the vertebro-basilar system and the carotid system, they supplies in the different part of the brain, and usually they not mixed. But when required, such as pressure in one side decreases, then some of the blood comes to the another side. So here our answer, majority of the blood passing through the vessels mixed together, it is not true because it usually not mixed, it's separate. Then other options such as the anterior communicating artery links to the right and left side, it is true. In this picture we saw this is the anterior communicating artery and it connects between the two side. Here this is the anterior communicating artery. Then asymmetry of the circle of Willis is a risk factor of the aneurysmal development, it is also true. Includes anterior communicating artery, yes, circle of Willis is formed by anterior communicating artery, posterior communicating artery, anterior cerebral artery, posterior cerebral artery, and bifurcation of the basilar artery. Then circle of Willis, it surrounds the stalk of the pituitary gland, it is also true. So false in case of the circle of Willis, that it usually don't mix, it supply the brain the separate part. Thank you all.